Hello, and welcome to Local Discovery Spotlight on Health, the show that travels the country in search of answers to how we can all live a more healthy, active, and stress-free life. I'm Kristen Martin, and today we're in sunny Tallahassee, Florida to meet with the professionals at Tallahassee Memorial Healthcare. For the next half hour, I'll be quizzing the doctors, polling the nurses, and speaking with the patients to find answers to all of your healthcare questions, from heart health and joint replacement to children's services and the use of robotics in the operating room. If it will benefit you and your health, you'll find it here first on Local Discovery Spotlight on Health. Caring for a sick or hurt child takes great compassion, knowledge, and insight, as well as a friendly smile. And that's exactly what you'll find as soon as you enter pediatrics.
Well, the atmosphere in pediatrics is very upbeat. The walls are painted in the rooms, and we have tiles on the ceilings that are painted. It's a very lively atmosphere. Kids are great because they are happy even when they're sick. The nurses enjoy the atmosphere because they get to play as well as work. There's bears and stuffed animals, and we have bubbles and all kinds of fun things for the kids even when they're sick and in the hospital.
Jessica, obviously children and their families have different needs when it comes to their health care. How do you accommodate for those needs?
Well, I think with children, you have to remember that you're dealing with the child who's a patient as well as the family. And so we remember that children are at different developmental stages. We have infants and toddlers and adolescents. And so you have to explain what's happening at a level that they can understand, but you also have to explain it to the parent and the grandparent in a way that they can understand. We have different resources. We're standing here in the playroom, which is a great place for children to come and play during the time of their visit when they're healthy enough to. We also have a Ronald McDonald room where the parents can get away and out of the patient room and take care of any information that they need to while their child's in the hospital.
All right, tell me a little bit about your kids' corner, because that's really unique as far as an outpatient unit within pediatrics.
Yeah, it's an outpatient unit. It's right here on the same floor as the inpatient unit. Kids can come if they need blood work drawn or any type of procedure or the same day outpatient surgery. They can come right in, and they'll have nurses that are used to dealing with kids to do things like put their IV in and prepare for the procedure. You know, they have the procedure done, they come back to Kids Corner, they get all the education and information they need to care for their child at home.
Anytime you have to bring your child into the hospital, it's, you know, a scary, stressful experience, but knowing you're bringing them into people who are caring and knowledgeable definitely makes it easier. They always ask about the parents' needs, my needs, as well as the needs of the boys. They try to make sure we're, you know, comfortable and have everything that we need.
And speaking of the staff, the way I see it, you really have a twofold role. You're a medical care provider, but you also have to lend a sympathetic ear.
Yes, you're definitely right. The nurses here very much provide excellent medical care, but they also have to listen to families and their concerns and worries about the child, as well as take care of the child and understand what's going on at their level. And a lot of times children don't understand why they're in the hospital and why we're having to stick them with needles or do procedures that they don't like very much. And so we have to be very sympathetic in their care, as well as providing good medical care as well.
Since we've started bringing Evan and Zach in here to pediatrics, there's been a lot of changes. They're smiling, happy babies who the staff have grown to love and really treat us like family.
If you've been wondering how advanced technology is helping to improve the medical treatment you receive, just open the door to robotic surgery. Considering the advances being made in medical robotic technology, I think it's safe to say that robotics is no longer just for toy collectors and techies. These two robotic arms that Dr. Ramsey is skillfully manipulating in this demonstration are advancing surgical possibilities with lightning speed. With dual console capability, improved 3D, high-definition vision, up to 10 times magnification, and expanded fingertip controls, the new Da Vinci SI surgical system provides unparalleled precision, dexterity, and control. Whether for hysterectomy, prostate surgery, or the treatment of gynecological cancers, the two new Da Vinci SI robotic surgery systems offer a minimally invasive surgical option with faster recovery time. Almost everyone knows someone who's been affected by cancer. One thing is certain, the earlier the cancer can be detected, the more options there are for treatment and elimination. For this reason, we're going to highlight a variety of screenings that could help save your life. Breast cancer is the most common type of cancer among women in the United States. The best way to fight breast cancer is through early detection.
Risk factors in developing breast cancer include age, obesity, family history, genetics, early onset of periods, late menopause, nursing, childbearing. Since 1990, breast mortality has gone down 99%. There's a reason for this, and most feel it's from better detection, early detection, better drugs, and better treatment overall.
Dr. Blank, I think it's safe to say that there has been some recent controversy about who should be getting mammograms and when they should start. Could you clarify this for us?
Hopefully. There was a lot of confusion back in the fall when a national task force came out with some different recommendations. I think since that time it's been clarified, they've sort of revised their position, and it's as it has been, which is annual mammography for women starting at age 40.
All right, tell me a little bit about digital mammography, because I understand that this new technology is really advancing patient care.
It really has. Digital mammography is just a different way of capturing, storing the images, and that allows us a little bit of freedom to manipulate the image and improve it. I think especially in younger women with dense breast tissue, it offers us a superior image.
All right, the truth about self-breast examinations, because I'm a good patient, I listen to what my doctor says, but I don't really know what I'm looking for.
And that's okay. We're not asking you to be a doctor. What we're asking is to sort of pay attention, learn what's normal for you. And by doing that monthly, you learn sort of what feels normal, so that if something abnormal shows up, you'll be the first to notice it.
All right, well, what are the benefits then for working with a comprehensive center like the Sharon Ewing Walker Breast Health Center?
Well, what we'd like to do and are striving to do is create a seamless experience from screening and in folks who are diagnosed with a breast cancer, a seamless experience from biopsy through treatment.
All right, great. Thank you so much for answering my questions. Early detection can save your life. Schedule your mammogram with your doctor today and commit yourself to self-breast examinations. I know I will. So this is the actual news.
Did you know worldwide in developing countries cervical cancer is the #1 cancer in women? In the United States, 11,000 women approximately would be diagnosed, resulting in 5,000 deaths. Prior to 1930, cervical cancer was one of the leading cancers in women in the United States. Since the advent of the Pap smear, the incidence of cervical cancer has dropped dramatically. It is important to get your Pap smear done annually.
As you Big Bend residents know, the sun is a daily factor in protecting yourself against cancer.
Ultraviolet radiation actually comes in two forms, and both are quite harmful to human skin. Ultraviolet B is what causes sunburns, and that's what SPF protects against in sunscreens, but it also causes skin cancer. Ultraviolet A doesn't cause sunburns but causes tanning, but it penetrates deeper, destroys collagen and elastic tissue, and contributes to photoaging as well as skin cancer. The best way to detect melanomas are twofold. Number one is self-skin checks, and that includes looking for any lesions that are asymmetric, have border irregularity, or irregular colors. The new thing is anything that's evolving, anything that's growing, changing, or bleeding. The second way is to have a full-body skin examination by a board-certified dermatologist at least once a year, and more often if you have had a history of other cancers. The best way to prevent skin cancer is to use very good sun protection, and that includes high SPF sunscreens daily, sun protective clothing, and to stay out of tanning beds.
Remember, slip, slop, slap, and wrap. That is, slip on a shirt, slop on the lotion, slap on a hat, and wrap on your favorite pair of sunglasses to protect yourself against the sun's harmful rays.